Psychosis program to try and intervene early in the course of an onset of a psychotic disorder. Psychosis doesn't usually just present full-blown. There's often a period of 1 to 2 years before someone develops a psychotic disorder, when there's deterioration in their social relationships, often their academic abilities or their skills of daily living. We're interested in trying to get referrals even before people have a full-blown psychosis in order to do a comprehensive assessment, as this allows us to decide whether we need to intervene with medications or whether we just need to support the person and try and ensure they have adequate information about what psychosis is, the sort of triggers that might affect it, such as substance use or too much stress, and to try and, if we can, help people to avoid developing a psychotic illness. Psychotic symptoms are basically when people lose contact with reality, and that can be exemplified by people hearing voices, believing that people are talking about them, commenting on their actions, telling them to do things. Or they may have delusional beliefs, that is, they may think the police are against them, some other government agency might be trying to pursue them, or they may start to see special significance in cars parked on the street.
Early psychosis is, the premise behind it, or the philosophy behind it, is that you want to get in early, and the earlier that you can get in and help deal with somebody going through psychosis, the better off the outcome will be.
The Early Psychosis Intervention Program has two main goals. The first goal is to provide education to the public on what are the early symptoms of psychosis and how to get connected to services. The second goal is to identify young people between the ages of 16 and 35 who might be having their first symptoms of psychosis. The aims of the program is to provide an assessment of those young people, diagnosis, and then treatment services if they're required.
I go into the high schools and I do a partnership program that the B.C.S.S. has developed, and so what we do is we take a person who's diagnosed with a mental illness and then a family member who has somebody who's diagnosed with a mental illness and myself, and we go into high school classrooms, grade 10, 11, and 12, and we do a little presentation and we educate people about what psychosis is. We're saying, you know, it's at this point in your life right now that you're going to start to see, you know, your friends changing, and if they're going to be developing a mental illness, here's what the warning signs might be, and if you're concerned about somebody, here's what you can do, here's where you can get help. Where we're putting our thrust for early intervention, because the earlier we can get somebody into service, the better off they're going to be.
As part of our program, we have one of our nurses and often myself go out to the schools, and we do provide education to the school counsellors, and we do this regularly every year because the school counsellors are always changing, to try and identify people at risk of developing a psychotic illness.
When a high school counselor contacts me because they've identified a student in their school that they have concerns about, I will go to the high school and do an assessment of that student. That assessment usually consists of me meeting with the student, asking them some questions around what they're experiencing, and from that interview determining whether there's need for any further follow-up for that student. If there are enough warning signs there for me to identify that yes, we should be looking at further services, then I set up an appointment with a psychiatrist to do a formal diagnostic assessment.
Our testing, which includes such things as doing a CAT scan to look at the structure of the brain, an EEG to see if there's any abnormal electrical activity which might cause a psychosis, and psychological testing, which is very much focused on whether people have what's called executive dysfunction. That is, that the frontal part of their brain is not able to process and particularly do abstract reasoning. In adolescence, there are obviously a number of people who start to be doing not so well at school, and their family or friends may be worried that they're in the early stages of a psychotic illness. In addition to the testing, what we tend to look at is, does the person become very withdrawn, or is it that they no longer conform to the rules of a household? So someone who starts smoking lots of dope, staying out late, not following the rules, but maintains social friendships, is probably not developing schizophrenia. If someone starts to no longer bathe, no longer put on clean clothes, starts to isolate in their room, and their marks are doing poorly at school, this is more likely to be part of a serious mental illness such as schizophrenia. The use of street drugs has been a controversial area. I say controversial because most of our patients have experimented with street drugs. What research tells us now is that people who start smoking marijuana before the age of 15 increase their risk of schizophrenia by 7-fold. That is, instead of having a 1% risk, it's 7% risk. So it's clearly a significant risk.
Family support is another important part of EPI programs. Family members need information and education about the symptoms of psychosis and the services and treatments that are available. I will meet with families individually in the initial stages and provide them with information about symptoms, what kind of services we have, what kind of treatments we're using, medications, and answer any questions and try to dispel any fears they have. The EPI programs also like to encourage family members to participate in other services provided by the BC Schizophrenia Society. And those are things like our Saturday support group, which is specifically for EPI families, and the Strengthening Families course that B.C.S.S. provides.
The quicker you can get a response for somebody who is dealing with a psychosis, the better off they'll be. They can attain their goals, they can move forward, and be productive members of the community, and nothing should hold them back.